Hey future nurses, let's go over some quick and powerful test-taking tips to help you think like a nurse and pass like a pro. These are practical, common-sense reminders that can help you answer questions faster and more accurately. Let's dive in. Alcohol is never the answer. If you see alcohol as a choice, skip it. It's never considered good in nursing scenarios. Sugar is bad unless the patient is hypoglycemic. If blood sugar is low, sugar saves lives. Otherwise, it's not the answer. Smoking. Always a no. No situation makes smoking a good idea. It's always harmful. If the patient is alive, think ABC, airway, breathing, circulation. Always prioritize in that order. Unless it's CPR, then it's CAB. Salt is usually bad, unless the patient has Addison's disease. Remember, add salt for Addison. But watch out, some salt substitutes contain potassium. Hydration is important. Encourage fluids unless the patient has heart failure or kidney issues. Never restrict fluids unless it's ordered. Never jump straight to restraints. Restraints should always be the last resort, never the first move. Always start with the least invasive intervention. Before calling the doctor or doing a procedure, try simple, non-invasive solutions. Remember Maslow's hierarchy of needs. Always meet physiological needs first, like food, water, and oxygen before moving to safety, love, or self-esteem. Take medications as prescribed and finish antibiotics. Don't stop just because symptoms improve. Intensive spirometry prevents lung complications. It helps prevent atelectasis and pneumonia, especially after surgery. Walking after surgery prevents DVTs. Get those post-op patients moving. Unless contraindicated, don't be rough unless it's scrubbing the forehub. That's the one thing we do aggressively in nursing. Ask open-ended questions. These give you more information and help build trust. Exercise is generally a good thing, unless there's a specific reason to avoid it. Promoting physical activity is usually the right answer. Smaller meals and good oral care support better nutrition, especially in patients with poor appetite or at risk for aspiration. Caffeine is never okay. It increases heart rate, affects sleep, and can worsen anxiety or cardiac conditions. Always assess first. Before jumping to action, get more data. Assessment comes before intervention. Blood pressure is the fastest way to check for blood loss. A sudden drop in BP. Think hemorrhage. Always ask yourself, what will kill the patient the fastest? That's usually the answer you're looking for on the test. Final tip, don't just memorize. Think like a nurse. Use these clues to eliminate wrong answers and go with the one that keeps the patient safest. You've got this. Now go crush that exam.